All those involved in designing and conducting clinical trials are expected to be familiar with a number of set of rules and regulations as well as ethical principles. We have already met some of these when we discussed the Nuremberg Code, the Declaration of Helsinki, and more recently the Principles of Good Clinical Practice. Often it can seem daunting to have to learn about all of these, as well as several other sets of local, national and international guidelines, and then to work in accordance with them all. But in many ways, all these rules, regulations and principles are trying to achieve the same end, and that is to encourage researchers to think about clinical research in a particular way. And that state of mind revolves around three main concepts: safety, quality and respect. Above all, when conducting any form of clinical research, they must have the safety and well-being of their participants at the forefront of their thoughts. Researchers should design studies and carry them out with the participant in mind, always asking the question, is what we are doing as safe as it can be? The end result of any research project is of course a set of results that we hope will help change clinical practice for the better. They will only be able to do that though if the researchers have taken all the care necessary to ensure that the results are accurate. The quality of the work is therefore of great importance, and the various principles of research practice have a lot to say about how we should go about gathering and assessing the data. At the core of this is the call for good documentation. Of course, this is important in healthcare generally, but it is even more so in research, where the basic motto of the various regulatory agencies who govern research is, if it isn't documented, it didn't happen. And they should never forget that they are working with people. Research participants are not nameless numbers, but people with rights and dignity, and everything done in research should be done with respect. That respect will be evident when the participants are fully involved in the study process and researchers view them not as research subjects, but as the most important members of the research team. When researchers take the time to explain their projects to prospective participants and seek their truly informed consent, they are putting that respect into practice. So if we are involved in research, we should always ask ourselves three questions. Is what I plan to do as safe as possible? Will it produce the highest quality results? And is it respectful? If the answer to all these three questions is yes, then we can be sure we are working very much to the spirit of the various rules, regulations and sets of research principles that govern the conduct of research in the UK and around the world. However, if there is any doubt in our minds, we should pause for thought and think, how might we do it better?